Today he will speak about vaccination. Vaccination is complementary to infection control. So, Dr. Mostafa Ramadan, you are welcome.
Thank you, Dr. Hussein. It is a great honor to me to be here with you. Welcome in your second country, Egypt. I talk today about vaccination. Vaccination is a method of giving antigen to stimulate the immune response through active immunization. A vaccine is an immunobiological substance designed to produce a specific protection against a given disease. A vaccine is antigenic but not pathogenic. The history of vaccination starts as early as the humanity started. Evidence of sniffing powdered smallpox across in Egypt, hoping that small low grade of infection can prevent smallpox disease. After this, China started to sniff smallpox across. Then Turk introduced the term of vaccination. They take the crust of smallpox infection and start to give it to some population, hoping to cause low grade of infection and prevent failure of smallpox. After this, in the 17th century, introduction of variolation in England and later on in the United States. As you see, this is the history of vaccination. It started in the 7th century when Indian Buddhists drank snake venoms to protect against snake bite. In the 10th century, variolation in China and Turkey. Early 17th, variola introduced into England. But we can say that the term of vaccinology and the science of vaccinology start by Edward Jenner in 1760 and 1770. He started the whole history of vaccination. Nowadays we reach to vaccination against rotavirus, human papillomavirus, herpes zoster vaccines. But the history started by this man who discovered smallpox vaccine. Vaccinology is the science of developing vaccine to prevent disease. And let's go back. In Greece, they found that people who survived the smallpox never got it again. The inside becoming infection by certain disease gave us immunity. Edward Jenner found that, and farmers who deal with cows never get infection with vaccines. He found that they got low grade of infection of smallpox in their early lives, and this low grade of infection protected them against smallpox, and this was the beginning of vaccination. Edward Jenner in 1796 isolated smallpox vaccine from cowpox and swinebox, and in the beginning of 18th century, compulsory childhood vaccination started. Vaccine achievement. At the end of the 20th century, the United States Center for Disease Control and Prevention, CDC, cited vaccination as the #1 public health achievement of that century. The elimination in 1977 of smallpox as a human disease must rank as one of the major achievements of modern medicine. So the history started in the 17th century and the smallpox ended in 1977. The types of vaccine, we have live vaccine, attenuated live vaccine, inactivated and killed vaccine, toxoid, polysaccharides and polypeptide, surface antigen vaccines. We have vaccines against viruses, smallpox, polio, hepatitis A, hepatitis B, influenza, measles, and so on. We have vaccination against bacteria, diphtheria, tetanus, meningitis, pneumonia, tuberculosis, and cholera. We have vaccine against some fungal infection, histoplasmosis, coccocytomycosis, blastomycosis, cryptococcosis, and candidiasis. We have vaccination against malaria, trypanosomiasis, leishmaniasis, and toxoplasmosis. We hope someday we can get a vaccination for leukemia, breast cancer, melanoma, prostate cancer, colon cancer, and we may vaccinate humans against autoimmune disease. Vaccine is good, but also had an ugly face. In immune compromised patient, when we give live attenuated vaccine, we can cause variation, we can cause flare up of severe infection. As in our special group patient, chronic kidney disease patient, we have alteration of the innate and adaptive immunity. And the infection, as our Prof. Nisrin said, infection is the second leading cause of death in hemodialysis patient. Between all types of all causes of disease, we found that cardiac cause is the first cause, but the second cause, about 17%, is infection. How are infections spread in dialysis patient? We have 5 routes for pathogen transmission among hemodialysis patient, on the hand of staff going between patient and between common areas and the patient, from ineffectively disinfected equipment and environmental services, from contaminated supplies and medications, from inadequate vascular access, and from virulent organisms like hepatitis B virus, which can live for at least 7 days on the surface in hemodialysis unit. While hand hygiene and surface disinfection is essential, hepatitis B live for more than 1 week, influenza for about 1 to 2 days, MRSA 7 days to 7 months, vancomycin resistant 5 days to 4 months, Clostridium difficile spore live for 5 months, and the healthcare workers touch at least 7 services after touching a contaminated one. So we transmit infection from 1 place to 7 places. This is the message of disinfection. But we are talking today about vaccination in hemodialysis patient. Is vaccination effective in hemodialysis patient like other population or not? As we know, in hemodialysis patient we have reduced response to vaccination.
Dr. Mostafa Ramadan, this is a question. Do you expect that the vaccinations in dialysis is effective as general population? Yes or no? Why? Why you are expecting that the efficacy of vaccine is lower in dialysis patients in comparison to the general population?
Because the efficiency of the immune system is not the same.
Okay.
When you vaccinate someone, you expect an immune response.
Okay, thank you, Dr. Mostafa.
As you said, when we give a vaccine to some of our population, to one patient of our patients, we expect that this vaccine will stimulate cellular mechanism and innate and antibody mechanism. In our subspecial group in hemodialysis patient, there is reduced response to vaccination because of the general immune suppression associated with uremia. There is decrease in cellular response and there is disturbance in humoral innate immunity, low complement 4 factor, decrease in cytokines response after stimulation. However, vaccine efficacy remains far from optimal in CKD population. First type vaccination is vaccination against the pneumococcal polysaccharides vaccine, single dose of half milliliter of the 23-valent pneumococcal polysaccharide vaccine. We give it intramuscular or subcutaneous. Dialysis patient 2 years of age or older will start as early as life, from neonates, from early life to late life, old age or young age. Revaccination is recommended after 3 years in children with chronic renal disease or when vaccination occurred 10 years old or younger at time of revaccination. Revaccination in adult within 5 years from the first dose of vaccination. Rationale: chronic renal failure patients are prone to pneumonia. More than 75 patients have an adequate response to vaccine. Pneumococcal vaccine is well tolerated with only minor side effects such as pain, erythema, itching, and burning at site of injection. In healthy person, we expect that when we're given pneumopolysaccharides vaccine, the lifelong is about 10 years, and then after 10 years, we need to revaccinate again, but in hemodialysis patient, to revaccinate after 5 years. The next one is influenza vaccine. We give influenza vaccine not only to hemodialysis patient and to the workers, to the nurse, to his family, to protect the hemodialysis patient from getting infected by influenza. Influenza vaccine should be given annually before the beginning of the influenza season for persons 6 months of age or older on dialysis. Household workers and the healthcare workers should be also vaccinated annually to decrease the transmission to high-risk patients. We give influenza vaccine intramuscular for patients less than for population less than 9 years of age. We give 2 doses. From 9 to 12, we give 1 dose. More than 12, we give 1 dose from vaccines. Rationale: dialysis patients are at increased risk of influenza-related mortality. No systemic reaction have been reported following influenza vaccination in dialysis patients. My next question: can we give we can give live attenuated vaccine to hemodialysis patient or not?
Yes.
Je pense que pour les patients qui sont en insuffisance rénale terminale, je pense que les vaccins atténués quand même, c'est assez risquant. Je pense que c'est un risque pour un patient qui a une insuffisance rénale chronique terminale. Mais s'il n'est pas dans cette phase-là, je pense qu'on peut peut-être lui donner. Dans la phase terminale, je ne pense pas. Pour les vaccins vivants atténués, même vivants, je pense pas. C'est un risque, je pense.
In spite that some studies said there is no contraindication of giving live attenuated vaccine to hemodialysis patients, but we don't give live attenuated vaccine. Hemodialysis patients are immune-compromised patients, and giving live attenuated vaccine to them may flare up the infection. So, live attenuated vaccine are usually contraindicated in immunocompromised patients. Between the immunocompromised patient are hemodialysis patients. However, due to theoretical risk of poliomyelitis, oral polio vaccine, however, polio is common and was common in Egypt to tend to give oral polio to our patients. Measles,
Poliomyelitis is finished in Egypt.
was common,
And we witnessed since 2 years the disappearance of polio from Egypt. And this is thanks for vaccines. This is because of vaccine, because I remember many persons in the street who are crippled because of poliomyelitis in the young age. So thanks for vaccines.
Measles, mumps, and rubella vaccine should be given to all children, including those on dialysis between 12 and 15 months of age, with a booster dose between 4 and 6 years of age. Use of inactivated vaccine and toxoid dialysis. We can use Haemophilus influenza type B conjugate vaccine, Hib vaccine. We can use DT vaccine, diphtheria and tetanus toxoids and pertussis vaccines. Hepatitis A vaccines. Both children and adults should receive 2 doses of vaccine intramuscular injection. Hepatitis B vaccine. It is recommended that for uremic patient, a 4-dose schedule, 40 microgram per dose, given at 0 point, at 1 and 2 and the second month from starting hemodialysis. This is double the dose of vaccine in the usual population. Usually we give 20 microgram. Usually we give 3 doses of vaccine. But in hemodialysis patient we give 40 microgram per dose and give 4 times vaccination. Chronic hepatitis B virus is a silent killer. Half of all people with chronic hepatitis B virus show no symptoms. People who have the hepatitis B virus may infect others without knowing it. People often find out they have the hepatitis B virus after they get really sick, or it is usually too late or difficult to treat the infection. There is no cure for hepatitis B virus till now. Chronic hepatitis B is one of the top 10 causes of death all over the world. The hepatitis B virus is 100 times more virulent than HIV. Hepatitis B antigen has been detected on various environmental surfaces such as clamps, scissors, doorknobs, and dialysis machine control knobs in dialysis center with hepatitis B antigen positive patient. Patients on peritoneal dialysis have a lower prevalence of hepatitis B virus infection compared with hemodialysis patient. How hepatitis B is not spread? Hepatitis B is not spread by hugging, holding hands, sharing food, breastfeeding, kissing, or living with an infected person. As our Dr. Nagar had told us when I was a resident, hepatitis B virus can be transmitted by droplet infection. Just a droplet infection in a unit of hemodialysis unit who start dialysis for hepatitis B virus patient. We can transmit infection from just droplet infection to other patient. The hepatitis B surface antigen positivity rate in dialysis patient vary among different localities and correlate with the endemicity in the general population. Hepatitis B antigen positivity rates among dialysis patients are reported to be 0.9% in the United States of America, in Saudi Arabia about 11%, in Taiwan about 17%, in Brazil 10%. We can diagnose hepatitis B infection by using markers, hepatitis B antigen, hepatitis B antibody, hepatitis B core, immunoglobulin M and immunoglobulin G, hepatitis B E antigen and hepatitis B E antibody. We will talk today about another issue of hepatitis B infection, which is called occult hepatitis B infection. Occult hepatitis B infection. The problem to diagnose hepatitis B in our patient is transaminase level is usually normal. One of the diagnostic points for hepatitis B virus infection is elevated enzymes, but usually in hemodialysis patients there is normal level of transaminases. And the level of hepatitis B virus DNA in hemodialysis patient is very low. So we have very low PCR with normal enzymes and sometimes with negative hepatitis B antigen. Still, the liver biopsy is the only definitive and reliable means to establish the activity of liver disease in dialysis patient. and it is recommended before starting antiviral therapy and undergoing kidney transplantation. Occult hepatitis B virus is detection of hepatitis B virus DNA in the serum or in the liver by sensitive diagnostic test in hepatitis B is antigen negative patient with or without other serological marker. First one described occult hepatitis B was Tabor et al. In 1979, who found the presence of occult hepatitis B infection among blood recipient from a donor with occult hepatitis B viral infection. Occult B infection prevalence seemed to be higher among subjects at a higher risk of hepatitis B infection and with liver disease. Occult B infection is the major cause of post-transfusion hepatitis B in Western country and in countries like India and Taiwan with high risk of transmission than for HCV or HIV. We have a seronegative hepatitis B antigen. Hepatitis B antigen negative with very low DNA, less than 200 international units per milli. This is a typical case of occult hepatitis B infection. Occult hepatitis B infection among hemodialysis patients ranging from 0% to 20% in some population. The prevalence of occult hepatitis B in Egypt is still a mystery. We have many studies to detect the prevalence of occult B in Egypt. The first one was in Upper Egypt. Prevalence of occult hepatitis B virus infection in hemodialysis patient from Egypt with or without C virus infection. Second one was in Alexandria in 2012. And third one was in our Mansoura University Hospital. And the fourth one in Alexandria again. And fifth one in Upper Egypt again. And the result was 4.1% in Upper Egypt, 26.8% in Alexandria, 80% in Mansoura, 32% in North Egypt, Alexandria, and in Suez Canal, 1.8%. We have many questions for hepatitis B. Every question wants another lecture. The first question, treat or not to treat? Isolate or not to isolate? Is ELISA enough for diagnosis of hepatitis B virus infection? Vaccinate or not to vaccinate? This is all types of viral bacterial that should be vaccinated, that should all patients in hemodialysis take the vaccines. All hemodialysis patients should take the vaccine for influenza, for tetanus, diphtheria, and pertussis, for varicella, for human papilloma virus, for human herpes zoster virus, for measles, mumps, and rubella, for pneumococcal infection, for hepatitis A infection, for hepatitis B infection, and for meningococcal infection. At the end, Aflatun said in his book, The Republic, tell me, this physician of whom you were just speaking, is he a money maker, an earner of fees, or a healer of sick and sick?
Thank you very much, dear friend Dr. Mostafa Ramadan, for this elegant talk. I always admire the presentations focusing on prevention. So I like the presentation and I like your presentation, and I think it is it's time to receive your questions. Yes, Dr. Samir.
Thank you, Dr. Mostafa, for your excellent talk. I want just to add some points for teaching here for our colleagues. After finishing the hepatitis B vaccine, 1, 2, and 1, 2, 3, and the fourth vaccine, you must test for hepatitis B cells antibodies 1 month later. If it is still negative, not to the target is about 10. If it is still negative, we can give booster dose, and after another month you can give booster dose if it's still negative. After that, we can repeat hepatitis B vaccine again, and we can check after completion of hepatitis B vaccine if the patient is still negative for hepatitis B cells antibodies. He can be considered as resistant to hepatitis B vaccination.